These are warning signs your body sends you every single day that could save your life, and most people flush them away without thinking twice. When colorectal cancer gets caught at stage 1, the 5-year survival rate sits at 91.5%, but that number crashes to just 16.2% by stage 4. What makes this matter for everyone watching right now is that 75% of colorectal cancers show up in patients 55 and older, with 66 being the median age at diagnosis. Your body drops clues every day, right there in the toilet bowl. Today we're covering what different stool shapes actually mean, what colors are trying to tell you, and which warning signs should send you straight to your doctor. This isn't about scaring anyone. Knowing what to look for ranks among the most powerful things you can do for your own health. Let's start with something doctors have relied on for decades. Section 1. The Bristol Stool Chart. Researchers at Bristol Royal Infirmary developed the Bristol Stool Scale back in 1997, and it appeared in the Scandinavian Journal of Gastroenterology that same year. The name sounds clinical, but the tool itself gives you a practical way to figure out whether what you're seeing looks healthy or not. 7 types make up the scale, and each one tells you something different. Separate hard lumps resembling nuts or pebbles fall under type 1, and this signals severe constipation because the stool sat in the colon too long and lost too much moisture. Type 2 appears lumpy and sausage-shaped but remains hard and difficult to pass, which still counts as constipation, just a less severe version. Types 3 and 4 represent the gold standard, and here's what to look for with each. Type 3 resembles a sausage with cracks along the surface, while Type 4 comes out smooth, soft, and shaped like a snake. Both indicate healthy transit time and proper hydration, so these are what you want to see. Type 5 shows up as soft blobs with clear-cut edges, which lands in borderline normal territory but might suggest you need more fiber. Fluffy, mushy pieces with ragged edges characterize Type 6, indicating mild diarrhea, where food moves through too quickly. Type 7 contains no solid pieces at all, just watery stool, and this severe diarrhea can lead to dehydration fast if it continues. Here's where things get specific for seniors. The National Institute on Aging reports that roughly 1/3 of adults over 60 deal with occasional constipation, and that number climbs past 50% for nursing home residents. Constipation becomes more common with age for several reasons, including decreased colonic contractions, medication side effects, reduced mobility, and not drinking enough fluids. Opioids, calcium channel blockers, iron supplements, and certain antidepressants all contribute to constipation as a known side effect. So if you take any of these and struggle with regularity, there's your likely explanation. The takeaway here comes down to this. Consistently seeing types 3 or 4 means your digestive system works well, while consistently seeing types 1 and 2 or types 6 and 7 deserves attention, especially when the pattern persists. Section 2. What about thin or narrow stools? Thin, pencil-shaped, or ribbon-like stools cause a lot of worry, and that fear usually jumps straight to colorectal cancer. So let me address this directly. Cancer can cause narrow stools, but context changes everything. Mayo Clinic puts it this way. Narrow stools that happen now and then probably are harmless, but in some cases, narrow stools, especially if pencil thin, may be a sign that the colon is narrowing or has a blockage. The most common causes turn out to be benign. Low-fiber diets rank high on the list, and irritable bowel syndrome causes them frequently. Pelvic floor dysfunction, where muscles contract and narrow the passage, accounts for many cases too. A study published in Digestive Diseases and Sciences found that pencil-thin stool on its own doesn't reliably indicate colorectal cancer. Dr. Curtin Nadial, a GI medical oncologist at Houston Methodist, backs this up. Thin or narrow stools alone aren't a reliable indicator of colon cancer. What changes the equation is when thin stools arrive alongside other symptoms. Rectal bleeding, especially dark blood, raises a red flag. Unexplained weight loss combined with thin stools warrants concern, and the same goes for persistent abdominal pain or iron deficiency anemia. Men should know about one additional cause. An enlarged prostate, called benign prostatic hyperplasia, can press against the rectum and narrow stool, and this becomes increasingly common with age. 1 to 2 weeks serves as the key time frame to remember. Thin stools lasting beyond that point call for a conversation with your healthcare provider, but an occasional thin stool on its own usually means nothing. Section 3. What stool color tells you. Color turns your stool into a window, showing what's happening inside, and certain changes signal something serious. Light brown to dark brown covers the normal range. Bilirubin, a breakdown product of hemoglobin, creates this color along with bile processed through the digestive tract, and day-to-day variations happen to everyone. Black, tarry stools doctors call this melena, and it demands urgent attention. The appearance is jet black, sticky, tar-like, with a distinctive foul odor, and this indicates upper gastrointestinal bleeding from the esophagus, stomach, or upper small intestine. Stomach acid digests the blood and turns it black during the process. Peptic ulcers cause most cases, but gastritis, esophageal varices from liver disease, and GI cancers also produce this appearance. Black tarry stools combined with dizziness, vomiting blood, weakness, or rapid heartbeat constitute a medical emergency, which means calling 911 or getting to an emergency room immediately. Here's a distinction worth knowing about. Iron supplements and bismuth medications like Pepto-Bismol darken stool too, but this version appears uniformly dark without the tarry texture or foul smell. Taking iron or Pepto-Bismol and noticing darker stool probably explains the change, but tarry and foul-smelling points to something different. Bright red blood. Bright red blood typically originates in the lower GI tract, meaning the colon, rectum, or anus. Hemorrhoids and anal fissures commonly cause this in seniors, and both are benign. Diverticulosis accounts for over 40% of lower GI bleeding cases and becomes more common as people age. Blood from colorectal cancer tends to look darker, persist longer, and show up at any time, rather than only during bowel movements. Any rectal bleeding in adults over 50 deserves medical evaluation, even when hemorrhoids seem like the obvious explanation. Assumptions aren't worth the risk. Pale, clay-colored, or white stools. Without bile reaching the intestines, stool loses its brown pigment, and this signals a problem with the biliary system. Blocked bile ducts from gallstones or tumors can cause it, along with liver disease, gallbladder problems, or pancreatic cancer. Pale stools appearing together with jaundice and dark urine form the classic triad of biliary obstruction, and this combination requires immediate medical attention. Yellow, greasy, foul-smelling stools. Yellow stools that smell foul, look greasy, and tend to float indicate fat malabsorption, and the medical term for this is steatorrhea. Pancreatic insufficiency, pancreatic cancer, celiac disease, and bile duct blockage can all produce this in seniors. One medical source put it plainly: in older adults, you want to be careful not to miss a serious condition that's more common in the elderly, such as cancer. That's why paying close attention to the liver, gallbladder, and pancreas is extremely important. Green stools. Green vegetables, food coloring, or rapid intestinal transit typically explain green stools, and they're usually harmless. Green stools accompanied by fever, severe diarrhea lasting more than 3 days, or blood may indicate bacterial infections like salmonella or parasitic infections like giardia, and that combination warrants medical attention. Section 4. 8 warning signs. Seniors must monitor specific patterns and symptoms require heightened vigilance for adults over 60 beyond individual stool characteristics. Here are the 8 most important ones. Number 1. Blood in stool. Visible or hidden, blood in stool always requires investigation. Dr. Tawfiq Kachami, Director of Gastroenterology at City of Hope, Phoenix, states this clearly. Blood in the stool is always abnormal and needs to be investigated. Hidden blood, also called occult blood, only shows up through screening tests like the Phi-T test, and this makes it especially concerning because colorectal cancer or polyps may exist while producing nothing visible. Number 2. Persistent changes in bowel habits. Changes lasting more than a few days to 2 weeks call for a doctor visit. The American Cancer Society lists a change in bowel habits, such as diarrhea, constipation, or narrowing of the stool that lasts for more than a few days, as a colorectal cancer warning sign, and this includes new onset constipation, unusual diarrhea, or alternating between both. Number 3. The feeling of incomplete evacuation. Tenesmus describes the persistent sensation that you haven't completely emptied your bowels even after repeated bathroom trips. The American Cancer Society, Mayo Clinic, and MD Anderson Cancer Center all list this as a specific colorectal cancer warning sign because tumors near the rectum create constant pressure that produces this feeling. Number 4. Unexplained weight loss with bowel changes. Losing weight without trying, while also experiencing bowel habit changes, demands prompt evaluation. Cancer releases hormones affecting metabolism, and GI malignancies frequently cause weight loss alongside digestive symptoms. Number 5. Abdominal pain or cramping with stool changes. A National Cancer Institute study identified abdominal discomfort as the most common early warning sign in people later diagnosed with colorectal cancer, appearing in 11.6% of those eventually diagnosed. Number 6. Persistent mucus in stool. Some mucus counts as normal, but persistent excessive mucus or mucus accompanied by blood or other symptoms deserves a conversation with your doctor. Number 7. New onset fecal incontinence. Roughly 1 in 5 adults over 65 experiences this, and it may indicate underlying GI conditions rather than just being an embarrassing problem to manage. Number 8. Unexplained anemia. Iron deficiency anemia frequently results from slow, chronic blood loss in the GI tract, and it often serves as the first detectable sign of colorectal cancer. Anemia without an obvious explanation needs further investigation. Section 5. Common conditions that cause these changes. Context matters when interpreting stool changes, so here are the conditions that commonly cause them in seniors. Colorectal cancer warning signs include blood in stool, whether visible or hidden, narrow stools from tumors constricting the passage, bowel habit changes, the sensation of incomplete evacuation, and iron deficiency anemia from chronic blood loss. A striking statistic puts screening into perspective. 56 to 60% of colorectal cancers detected through screening produce no symptoms whatsoever at the time of diagnosis. The majority of cancers caught by screening had given no warning signs at all, and that's exactly why screening matters so much. Symptoms alone won't protect you. Diverticulosis. 60% of adults develop this condition by age 60, and that number rises to 70% for those over 80, making it nearly universal among older populations. Most people with diverticulosis experience no symptoms. Bleeding diverticula cause painless, often heavy bright red rectal bleeding, while infected diverticula, called diverticulitis, produce left lower abdominal pain, constipation or diarrhea, and sometimes narrow or pellet-like stools. Hemorrhoids. About 50% of adults over 50 have hemorrhoids, which cause bright red blood during and after bowel movements, along with itching and discomfort around the anus. The distinction from cancer matters. Hemorrhoid bleeding comes and goes, usually clears up within 1 to 2 weeks, and happens specifically with bowel movements. Cancer-related bleeding persists longer, may occur at any time, and typically arrives with other symptoms. Inflammatory bowel disease, Crohn's disease, and ulcerative colitis can develop at any age. Ulcerative colitis characteristically produces diarrhea mixed with blood and mucus, while Crohn's disease may create fatty, malabsorptive stools when it affects the small intestine. Medication effects. Seniors taking multiple prescriptions need to pay special attention here. NSAIDs, including aspirin, ibuprofen, and naproxen, rank as a leading cause of upper GI bleeding, and blood thinners increase bleeding risk from any source. Iron supplements and bismuth products like Pepto-Bismol cause harmless black stool, as mentioned earlier. Antibiotics disrupt gut bacteria and raise the risk of Clostridioides difficile infection, a serious cause of watery, foul-smelling diarrhea that hits hospitalized seniors especially hard. Section 6. When to seek care. Clear guidance on emergency care versus scheduled appointments can help you respond appropriately. Go to the emergency room or call 911 for inability to pass stool or gas combined with severe abdominal pain, since this could indicate a bowel obstruction. Large amounts of blood in your stool. Black tarry stools accompanied by dizziness, weakness, or rapid heartbeat. Pale stools together with jaundice and fever. Schedule an appointment within days for blood on toilet paper or in the bowl, even when you assume hemorrhoids caused it. Persistent bowel habit changes lasting more than a few days. Unexplained weight loss. Narrow stools persisting beyond 1 to 2 weeks. Abdominal pain combined with stool changes. The persistent feeling that you haven't completely emptied your bowels. What to expect at your appointment. Your doctor will take a thorough medical history and conduct a physical examination, which includes examining your abdomen and potentially performing a digital rectal exam. Diagnostic tests may include a fecal immunochemical test called FIT to detect hidden blood, along with stool analysis, blood tests checking for anemia or infection, and potentially a colonoscopy for direct visualization. Section 7. Screening saves lives. The most important part of everything we've covered comes down to screening. Colorectal cancer screening beginning at age 45 for average-risk adults carries recommendations from the U.S. Preventive Services Task Force, American Cancer Society, and American College of Gastroenterology. All three organizations strongly recommend screening for ages 50 to 75 with high certainty of substantial benefit. Screening for ages 76 to 85 becomes an individualized decision based on overall health, life expectancy, prior screening history, and personal preferences. The U.S. Preventive Services Task Force notes that adults who have never been screened benefit most from screening in this age range. After age 85, screening generally isn't recommended because potential harms outweigh benefits. Options for screening include colonoscopy every 10 years, which serves as the gold standard because it detects and removes polyps in the same procedure. FIT testing done annually offers another route, and Cologuard, a stool DNA test, can be performed every 1 to 3 years. The FDA approved Shield in 2024, a blood-based test detecting 83% of colorectal cancers for adults who decline other screening methods. Cologuard Plus received approval in October 2024 with improved sensitivity at 95% for colorectal cancer, and Medicare coverage is expected to follow in 2025. Conclusion. Numbers tell the story of why everything we've discussed matters so much. Colorectal cancer ranks as the fourth most common cancer and second leading cause of cancer death in the United States, with the American Cancer Society estimating 154,170 new cases in 2025. Lifetime risk breaks down to 1 in 23 for men and 1 in 25 for women. The number that matters most is this. Localized colorectal cancer carries a 5-year survival rate of 91.5%. while cancer that has spread to distant sites drops to 16.2%. One study found 87% survival among asymptomatic patients detected through screening, compared to just 57% for symptomatic patients. Stage 0 or Stage 1 accounted for 61% of screen-detected cancers, versus only 16% in the group who showed up with symptoms. Current data shows roughly 72.6% of adults aged 50 to 75 have received appropriate screening, but over 20 million eligible Americans remain unscreened. Dr. Christopher Kim, a gastroenterologist at Houston Methodist, puts it this way. Anytime you see blood in your stool or have rectal bleeding that is accompanied by changes in your bowel habits or to the color or consistency of your stool, it's critical that you see a gastroenterologist. Dr. Michael J. Gilbert, a board-certified gastroenterologist, adds this perspective. Colorectal cancer is one of the most preventable cancers. When caught early, it's highly treatable. Regular screenings and a healthy lifestyle are your best defenses. Here's what to take away from everything we've covered. Types 3 and 4 on the Bristol Scale represent healthy stool, and persistent deviation from that deserves attention. Black tarry stools and pale clay-colored stools require urgent evaluation. Any blood in stool, even when hemorrhoids seem obvious, should be discussed with your doctor. Changes lasting more than a few days to 2 weeks call for a medical consultation. Regular screening catches cancer when treatment works best, often before any symptoms appear at all. Your body communicates with you every single day. Now you know how to listen. Thank you for watching. Share this information with someone you care about and subscribe for more health content you can actually use. Take care of yourselves.